All right, everyone, this is test your knowledge of joints / articulations. Per usual, for some of these, there's going to be a definition that you want to be able to give me the answer as to what it is being defined. There also might be a picture where you're going to have to identify something as well. But let's go ahead and we're going to begin with some of the terminology regarding movement. So this is movement that decreases the angle between bones. The answer is flexion, right? So when you bend your arm, you are flexing it because you are decreasing the angle between your forearm and your humerus. Rotation of the forearm and hand laterally so that the palm faces anteriorly. The answer is supination, right? So that's when you're facing your palms anteriorly. This is, this is movement of the bone away from the midline of the body. The answer is abduction. So when you are moving your bone away from the midline of the body, you are abducting. This is anterior movement of a body part. The answer is protraction. So when you are pushing your head forward, right, anteriorly, you are protracting. This is lifting of the foot so that the toes are pulled upward toward the head. The answer is dorsiflexion. This is movement that increases the angle between bones. The answer is extension. So when you are straightening your arm, you are extending it because you are increasing the angle between your humerus and the bones of your forearm. This is the turning of a bone around its own longitudinal axis. The answer is rotation, such as when you are rotating your arm to face anteriorly. This is movement of the bone toward the midline of the body. The answer is adduction. So right, abduction is when you're moving a bone away from the midline. Adduction is moving it towards the midline. This is the depression of the foot by pointing toes towards the ground. The answer is plantarflexion. So when you are getting up on your tippy toes, that is actually plantarflexion. This is the continuation of an extension. The answer is hyperextension, such as when you hyperextend your head all the way down towards your spinal cord. This is posterior movement of a body part. The answer is retraction. So you are you are performing a protraction when you push your head out anteriorly, but when you pull it back in, you are retracting it. This is the movement of the sole of the foot medially. The answer is inversion. This is the rotation of the forearm and hand medially so that the palm faces posteriorly. The answer is pronation. This is inferior movement of a body part. The answer is depression, such as when you are lowering your jaw. This is circular movement of the distal end of a body part. The answer is circumduction. This is superior movement of a body part. The answer is elevation, such as when you elevate your mandible to close your jaw or your mouth. This is the movement of the sole of the foot laterally. The answer is eversion. So now I'm going to ask you to start identifying parts of joints. This is asking you to identify part of just a general synovial joint at the end of the arrow. I will give you extra time. The answer is bursa. Identify part of the synovial joint at the end of the arrow. The answer is the synovial cavity, and within that cavity is the synovial fluid, which, remember, acts as that lubricant. Identify part of the general synovial joint at the end of the arrow. The answer is the synovial membrane. Once again, identify part of the synovial joint at the end of the arrow. The answer is the articular cartilage. Identify part of the general synovial joint at the end of the arrow and don't say ligament. The answer is the articular capsule. All right, now I'm going to ask you to identify types of synovial joints and also give one example. The answer is ball and socket. Examples of ball and socket joints, you could have said glenohumeral joint or the acetabulofemoral joint. What type of synovial joint is this? And please give an example. The answer is a hinge joint. Examples include the elbow or the knee, or the interphalangeal joints, also the temporomandibular joint. Remember, these are involved in extension and flexion. What type of synovial joint is this? And give one example. The answer is a plane joint. These are non-axial, so they really just provide slipping movement or gliding movement. Some examples of these are the intercarpal joints or your intertarsal joints, as well as your sacro-iliac joints. What type of synovial joint is this? Give one example. The answer is a condyloid joint. These are found in your knuckles, as well as your atlanto-occipital joint, which would be that joint between your atlas, right, your atlas cervical vertebra, and the occipital bone. What type of synovial joint is this? Give one example. That is a saddle joint. An example would be your carpometacarpal joint. What type of synovial joint is this? You want to give one example. The answer is the pivot joint, such as that between your atlas and your axis cervical vertebra. And also the proximal radial ulnar joint. All right, continuing through our joints, name the type of joint and then give the specific type. The answer is a fibrous joint, and it was specifically a suture. Once again, name the type of joint and then give the specific type. The answer was the synovial joint, and specifically the sacro-iliac joint. Name the type of joint and then give specific types. The answer was the fibrous joint, specifically a syndesmosis between the radius and the ulna. Name the type of joint and then give a specific type. The answer was the cartilaginous joint. This was specifically the pubic symphysis. Name the type of joint and then give a specific type. It was a fibrous joint. You saw the tooth. And the gomphosis is also sometimes called the dentoalveolar joint, so the answer is gomphosis, pertaining to the teeth. All right, now we're going to be naming specific synovial joints. Can you name the specific synovial joint? It is the knee joint. There are two types of joints found here, the tibiofemoral joint and the patellofemoral joint. What type of synovial joint is the knee joint? It is the hinge joint. All right, now you want to be able to identify parts of the knee joint at the end of the arrow. The answer is the anterior cruciate ligament, or your ACL. For any exam, you are going to want to write this out rather than give an abbreviation. Identify part of the knee joint at the end of the arrow. The answer is the patellar ligament. You guys saw the patella in that picture. Identify part of the knee joint at the end of the arrow. The answer was the lateral meniscus. Identify part of the knee joint at the end of the arrow. The arrow was pointing to articular cartilage. Identify part of the knee joint at the end of the arrow. The answer was the medial meniscus. Identify part of the knee joint at the end of the arrow. The answer was the posterior cruciate ligament. Once again, you want to make sure that you write this out on an exam. Do not abbreviate. Identify part of the knee joint at the end of the arrow. The answer is the tibial collateral ligament, but you can also call it the medial collateral ligament. Identify part of the knee joint at the end of the arrow. The answer is the fibrous capsule of a knee joint. All right, so name this type of synovial joint and be specific. You could have said the humeroradial joint, considering we were looking specifically at part of the humeroradial joint. What type of synovial joint is the humeroradial joint? It is also a hinge joint. You want to be able to identify part of the joint at the end of the arrow. The answer is the annular ligament of the radius. Name this type of synovial joint and be specific. You are looking at your elbow. That was the humero-ulnar joint. Identify part of the joint at the end of the arrow. The answer is the ulnar collateral joint. Name this type of synovial joint. The answer is the glenohumeral joint. What type of synovial joint is the glenohumeral joint? It is specifically a ball and socket. Identify part of the joint at the end of the arrow. The answer is the coracohumeral ligament. And that is it for Test Your Knowledge of Joints.